Okay, so in this video we will be starting an IV and doing the primary IV solution, heating that solution. So I just have my NAR off to the side. Okay, so before we start, we need to do the 6 rights of medication administration, which is right patient, right time, right dose, right drug, right route, and right documentation. And practicing hand hygiene, the precautions that need to be in place. Okay, then we check the MAR. So we have IV needed, and it says that she is allergic to penicillin and latex, so we'll have to watch out for what gloves we use, like non-latex gloves. Okay, and we need to check what the doctor ordered. So he ordered okay, so the doctor ordered an IV for this patient, normal saline, 1,000 milliliters, and I only have 50, so we're just gonna pretend, over 6 hours. Okay, so we'll have to gather all of our supplies that are okay for the patient. So we'll also have to ask the patient for 2 patient identifiers, so name and date of birth. And then we'll have to place the patient in a comfortable working position, height, and make sure that the patient is comfortable. Okay, now doing the solution, we will have to, for prepping the IV solution, we'll need to label it with the patient's name, the date, and the initials, and what the order says, like the time to start and time to stop. Okay, and then we gotta remove it from the package. There it is. Okay, so we'll have to make sure that the solution has no abnormalities. If it's not expired, just to make sure that it's good for the patient. Same with the tubing. Okay, so we have to lock it with the roller clamp, and okay, so we don't want to take off the cap yet on this yet. Okay, now we can take this off, make sure I don't touch this, and then you just spike the bag. Okay, once the bag is spiked, you hang it up on the pole. Okay, and then you press the drip chamber until it is halfway. So like, look at that. Okay, So now with this, okay, so once the bag is hanging, now we want to slowly prime the tubing and make sure there's no air bubbles so it is ready. Okay, so I'm going to make sure this does not get contaminated. So you slowly open up the roller and then you can see it coming down. Okay, so once it's primed, you want to just inspect the tubing if there's any air bubbles. If there's like a little bit, then it's okay, but if there's a lot, you would want to remove those. Okay, now you clamp it and hang on the pole so it does not get contaminated. Okay, now we will do the IV. So we'll need to place a linen, but I don't have one, or something to collect the blood. Okay, so we'll place the arm in a working condition. Okay, so place the tourniquet a few inches away from selected site, and you just palpate to feel if it like rebounds. Okay, so if there's any excess hair, you want to shave it, you know, make sure the site is clean. So now we'll loosen the tourniquet so we can gather our supplies. So we'll need saline syringe, the catheter, IV needle, the hub port, and all the gauze and stuff. So I will start getting all of my supplies ready, like opening up things, getting it all set up. Okay, so I got all of my supplies ready, got my gauze open, my tape ready, and my saline flush and the hub and stuff connected. So now I will reapply the tourniquet now that I'm ready. Okay, and then perform hand hygiene and grab my gloves. And then I will wipe over site in circular motions and let that to dry. Okay. Okay, so while that is drying, we'll grab our IV catheter out of the package. Okay, so we'll hold at the hub and then just make sure that it is loosened so we're able to advance. Okay, so now the bevel should be up and my butt is okay. So we'll need to pull down the skin, make sure that the skin is stable. Okay, so we'll go at an angle and go in. Once we see flashback, we have to go more, but then we need to advance the catheter, not the needle. Okay. Okay, then you dispose of the needle in the sharps container. So we're holding down where the vein is, so the blood kind of stops, and then we loosen up the tourniquet. And then we grab our saline and we connect. Okay, so we connect our, and then we flush about 5 cc's. Okay, so then we disconnect the saline. And then we grab our gauze. Then we put that underneath the IV site. We don't. Okay. And then we grab our piece of tape. Okay, so and then I'm wearing gloves still. The gloves, I'm limited on gloves. And then we just place the transparent. Okay, so we'll put over the transparent IV secure tape, and you want to make sure that you can be able to see the IV site. So make sure if you can look if there's any abnormalities, and then you just secure with more tape if needed, and secure the hub. So that's good. Now we need to establish the drip rate. So I came up with 28 drips per minute, so we'll have to just calculate that. Okay, I'm wearing gloves still. Hand hygiene. Okay, so we attach this to the saline port. So it's all connected. So now we calculate the drip rate. So we just have our watch on and we slowly do the drips. We just calculate how many drips come out of the drip chamber. And then that's how much will be infused into the patient. And you want to make sure there are no kinks or anything. So, okay, so then we'll dispose of all of our supplies, and I already did that while we were working. And then lower the patient in a low position and make sure that the patient is comfortable and the collate's in reach, and document everything that happened and how the patient will react to the infusion.